All right, welcome back to ABA Exam Review and the continuation of our BCBA practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure to check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst is designing an intervention plan that includes a brief timeout procedure. The client has a history of escape-maintained aggression. Which of the following ethical considerations is most important for the behavior analyst to address before implementing the timeout? So we have an ethical question. And on our task list, it talks about the ethics behind reinforcement, punishment, and extinction. And punishment is typically the one that carries the most ethical weight, given one, punishment is typically a last resort, and two, the negative implications that come along with punishment. So if we want to use timeout, which is inherently a punishment procedure, and the client has a history of escape-maintained aggression, what ethical consideration or considerations do we need to take into account first, or what's the most important? A, ensuring the timeout environment is stimulating and engaging to encourage the client to want to be there. Well, timeout's going to be a punishment procedure. If the client enjoys going to timeout, it might not be in our best interest as far as behavior reduction goes. Timeout's not always or necessarily going to be a place we want the client to be, given that it is part of the punishment. So making it stimulating and engaging might be the opposite of what we want. B, ensuring the procedure is the least restrictive effective intervention and having a plan in place to address potential escape attempts from the timeout. Of course, right? One, we always want the least restrictive intervention, meaning what is the intervention that is going to use the least punishment, the least aversives? How can we use more reinforcement-based interventions? Least restrictive is what we're always going for. Additionally, if the behavior is escape-maintained and we're using timeout, then we need to plan for potential escapes from that timeout. So B looks important. C, providing a time frame to the stakeholders related to the effectiveness of the intervention. Do we ever want to give a solid or strict time frame for effectiveness? No. It's unpredictable how our interventions are going to go. And what I mean by that is we are dealing with human behaviors, meaning an intervention that's worked 100 times in the past for 100 clients might not be effective for the 101st. So you never want to give any guarantees on time frames to stakeholders. D, assuring that the timeout is implemented for a minimum of 1 hour each time to ensure effectiveness. Well, that's way too broad of a generalization for timeout. Timeout and how long it is going to be client dependent. So that 1 hour is arbitrary. So if we're trying to pick the most important ethical consideration out of these options, one, ensure we're using the least restrictive intervention. Two, have a plan in place to address escape. A residential support staff is tracking a client's engagement and leisure activities during a scheduled hour. They divide the hour into 5-minute intervals. At the end of each 5-minute interval, they record whether the client engaged in any leisure activity at any point during that specific 5-minute interval. This data collection method is what? So this is going to be discontinuous measurement first. Second, it's going to be interval recording. And how do we know that? Well, one, interval is used a lot, but let's assume it wasn't. We know when we're using some sort of time sampling or interval recording when we take a long period of time and break it into chunks. So let's just think about how our discontinuous measurement works. If I have all these intervals of 5 minutes, if I require the client to engage in the behavior the whole time, what is that going to be called? That's going to be whole interval recording. If I require the client to engage in the behavior just part of the interval, that's going to be partial interval. If I require the client to engage in the behavior at a moment in time at the end of interval, that's going to be momentary time sampling. If you think about it like that, and you just think common sense wise how each one sounds. The whole time is whole interval, part of the time is partial, in the moment is momentary time sampling. if in this case, the client has to engage in leisure activity at any point during the 5 minutes, so part of that 5 minutes, what is that data collection method? That's going to be B, partial interval recording. Very straightforward discontinuous measurement question, not too challenging. A behavior analyst is working with parents of a child with autism. The parents report difficulty getting their child to follow simple instructions in various community settings, grocery store, park, restaurants. Which of the following ABA-related parent training strategies would be most appropriate for the behavior analyst to implement first if the parents have no prior training? Now, what a lot of people do when they look at a question like this, they see a ton of words, they see maybe some challenging ideas and challenging concepts and assume they're going to struggle with the question. Never assume you're going to struggle with the question. One, we're not jumping to the answer choices yet. We're going to attack the question first. So let's start there. Which of the following parent training strategies is most appropriate first if the parents have no prior training? We know we're working with this child with autism in a community setting. So pretty straightforward question, all things considered. How should we train the parents with no prior training given this scenario? So 2, now we go to our answer choices with a good idea in mind of what we're looking for. The best way to train first. What's the first part of training we should do in ABA? A, teach the parents how to implement a token economy system across all community settings. Now, token economy systems can be complex. They involve reinforcement, they involve reinforcement schedules, and then across all community settings, this group of parents have no prior training. Is that necessarily where we want to start? Maybe not. Is there a better place to start? B, educating the parents on the philosophical underpinnings of radical behaviorism and its implications. That is definitely not the place to start. That's not going to help the parents with their issue. You as the analyst need to know these things because you are the analyst. You're the professional. The parents do not need to know the philosophical underpinnings of radical behaviorism. C, teaching the parents how to provide clear, concise instructions, reinforce compliance, and utilize effective prompting. Yes, this is better than A because we're starting with the basics. Don't be in a rush with ABA. You can't rush ABA, okay? We cannot change how quickly things happen more often than not. And if these parents have no prior training, you've got to start with the beginning, and then you can build into more complex things like a token economy. And then D, instructing the parents to use punishment procedures such as response cost to decrease noncompliance in all community settings. This goes back to our least restrictive discussion. If you're teaching the parents from the beginning, we want to promote the idea that we're trying to use reinforcement instead of punishment as much as possible. So the most appropriate thing, first, teach the parents how to provide clear, concise instructions, reinforce compliance, and utilize effective prompting. An individual is learning to assemble a new piece of furniture by following the manufacturer's instructions. They attempt to assemble it multiple times. The data collected focuses on the number of attempts it takes for the individual to correctly assemble the furniture from start to finish without needing to refer back to the instructions. This number of attempts represents what? All right, another measurement question. Here we're looking at the number of attempts. And what is that related to? Well, this individual is trying to build furniture, and they're trying to do it multiple times. The data focuses on these number of attempts it takes for the individual to assemble the furniture start to finish without needing the instructions. In other words, how can this individual master or achieve their goal? How many attempts is it going to take to achieve their goal? Now, what type of measurement are we using when we track how many attempts it takes to reach mastery, or a criterion? The criterion here is start to finish without referring to instructions. And we're looking at how many trials it takes. If it takes 6 attempts for them, then 6 were the trials to criterion. Why is it not B, duration? Well, we're looking at a number or an amount, not necessarily a length of time. Why is it not rate? Well, rate is frequency over time. And yes, we're looking at frequency, but we're not looking at how quickly they're building the furniture or how many attempts per hour, let's say. And then whole interval recordings. Well, we're not breaking this into intervals and taking it that way. We're looking at how many times or how many trials it took for the individual to achieve the criterion or the goal. While teaching a client to identify their name on a worksheet, the therapist immediately points to the correct name as soon as the instruction is given. Over time, the therapist delays and fades the prompt until the client responds independently. Why is this method considered effective for early learners? Really, the challenging part of this question is they ask about the method, but they don't state the method specifically, right? They give you clues. What are our clues? Well, we know the client is learning to identify their name, and the therapist points to the correct name as soon as the instruction is given. So they give the SD, and they immediately prompt by giving the right answer. So if we're prompting immediately by giving the right answer, what are we trying to do? We're trying to prevent errors. We're errorless teaching. So essentially, the question is saying, why is errorless teaching effective for early learners? A, it ensures reinforcement is delivered after errors. We don't want to ensure reinforcement is delivered after errors necessarily. Errors lead to more errors. The point of errorless learning is to prevent errors so they don't become part of the chain. So B, it prevents errors from becoming part of the chain, is why errorless learning is typically considered effective. When we're teaching these new skills, we're trying to avoid errors because, again, errors lead to more errors and errors become part of the behavior. We're trying to avoid that. C, it teaches problem solving through trial and error. Well, errorless learning does not give the opportunity for trial and error. That's what we're trying to avoid. And D, it introduces a delay between the response and consequence. Remember, behavior to consequence, we want to happen immediately. That's the contiguity, the closeness. We don't want a delay. So why is this method considered effective? Why is errorless learning effective? It prevents errors from becoming part of the behavior chain. Errors lead to more errors. Thanks so much for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Make sure you like and subscribe. Work hard, study hard. See you soon.